So in this video, I'm discussing again the recall communications. That a 1 or 2 year old girl whose parents are Saudi Arabian, who has just been diagnosed with cystic fibrosis, was initially thrown by the fact that they were Arab and not Caucasian, but they figured out that it was not relevant. Discussed cystic fibrosis and its implications and offered the website leaflet and another meeting. The actress was very chatty, very helpful and chatty, although she was obviously tired and it was the last station of the day and she kept stifling events. Okay. So that is main task is that discuss the 65% implications of our website, leaflet and another meeting. So it is only 65% related information giving scenario. There are lots of 65 related will do. Okay. So we are starting like IRCP, introduce myself, making the repo and consent taking that it is a perfect time for you and agenda will tell that and also attendance and the prior knowledge. So I am Dr. Emma, one of the doctor here. I guess you are Alice Mammy, am I right? Yes, doctor. So, madam, it is really my honor to sit with a keen mom like you. Oh, thank you, doctor. With pleasure, ma'am. I'm here to talk to you with about Alice's condition. Would you like anyone to be here, or shall we start? No, doctor, just me. We can start. How much do you know about Alice's health conditions? So, the prior knowledge we are asking. Mother is telling, I really under. Mother is telling dot 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 lots of things what she knows. So I really understand it is really difficult, and I'm really sorry to tell you that the sweat test came positive for a condition called cystic fibrosis. I'm deeply sorry for that. So cystic fibrosis test is sweat test. It is came positive. So what is that, doctor? Have you heard about it before? No. What is that? So it is a condition. Cystic fibrosis is a condition affecting the secretions in all over our body. Are you with me? Okay. Normally in our lung, there are some secretions. These secretions are very important because it catch the bugs and help us to get rid of any bug and enter in our chest. Am I clear? So normal physiology, first we draw pictures like two lungs, normal lungs and another is cystic fibrosis lung. During cystic fibrosis and the bug attach will like that. So normal lung, what happened? There are some secretions in our body. These are very important because it expel the microorganisms, the bugs that enter in our chest. It prevents that. But what happens in cystic fibrosis conditions? But in children with cystic fibrosis, these secretions become really viscid and sticky. So these secretions attach to the bugs and instead of helping body to get rid of these bugs, they retain in the bugs inside our chest. And as these secretions difficult to be expelled out, and that is why she had repeated bugs in her chest. That will have a that's why we'll have a meeting with the 65 team headed by the chest doctor. He will give her antibiotics and will help you to do some exercise to help to get rid of these viscosity secretions as well as other medications to that decrease the viscosity of these secretions. Am I clear? So now we are telling the what happened in cystic fibrosis. This secretion become sticky and viscid. That's why this bug, instead of expelled out from the lung, that attached to these secretions. That's why she has problem. Repeated chest infections occur. That's to and we also include the management. We involve the chest doctor. We will give medicine for these viscid secretions. Also, some exercise show that she can get rid of that. Another we tell that, okay, doctor, in the tummy, we draw a picture of like leaf-like organ pancreas. In the tummy, it affects the leaf-like organ located here, pointing to our abdomen, called pancreas. Normally, this pancreas secrete the chemical substances help in food digestion called pancreatic enzymes. But in this disease, as I have mentioned, this disease affects the secretions all over the body. So it affects the pancreatic enzymes. It will be decreased, and that is why she is having loose motions and cannot absorb food nutrients. For that, she is not gaining weight, any weight. Are you with me? So also this secretion as whole body it attached, it affecting. So it also affect the leaf-like organ pancreas in your body, which is control the insulin, and that's why which is helping digestion of our food. But for this sticky secretions, it hampered our digestions, and that's why she's suffering the loose motions. So cystic fibrosis features is we know that cough and loose motions. Okay. So for management purpose of this pancreas, we will have a meeting with a diet doctor. He will help her with the special formula to get all the vitamins she needs, as well as there is a replacement for the pancreatic enzymes she will take. Are you with me? Okay. We need to follow her for very long time. Some children may develop disturbance in blood sugar control. Some children may have liver infection. but we'll follow up her. If anything appears, it will interfere immediately. We will interfere immediately. So we'll monitor her long time because some children 65 plus associated diabetes mellitus, we know that. So we do the RBS level, liver function test. These are we are doing regularly to check. Is it curable? Mother is asking. So with really empathized sound, we'll tell that I'm really sorry to tell you that unfortunately it is not curable, but luckily it is controllable. We can put it under control by follow up with specialized team. Why not discovered early? Because there is no test for 100% accurate. Any chance for next children to be affected? Unfortunately, yes, there are some chances. The best answer is the gene doctor. If you need, we can arrange a meeting with him. Cystic fibrosis autosomal recessive conditions. Okay. Did I do anything wrong? No, you did not do anything wrong, and it is better to avoid smoking, dust, perfumes, and pollens. She will take some extra shots to decrease exposure to the bugs. So that is not mother any fault. We'll tell advise that avoid smoking, dust, perfumes, and take some extra shot. As usual, summary, trusted website, leaflet will give and add the support group. Uh, One is 9 months with repeated exacerbation and not growing well. Explain the mother why this occurred. You should be very empathic, very clear knowledge. Not interrupt mother. Do not overload mother with a lot of information. Reassure but realistic. Growth failure is a part of cystic fibrosis. Things to be done to decrease the expectations. Compliance of the treatment. Stick to physiotherapy. Stick to antibiotics. Lies with the school if older age. So in cystic fibrosis, mother is complaining, child not gaining weight or not improving, then we'll be much empathized. Actually, we go with the flow of the rule player. So we tell that failure to thybos, not growing weight, that is a part of cystic fibrosis, but we can prevent that, or we can make like helpful, like taking some steps, like compliance with the treatment regularly, stick the physiotherapy, stick with the antibiotic, and lies with the school if older age. So these are supporting line will tell that. So this is all about cystic fibrosis communication. Thank you very much.